Almost 20% of our women patient population are miscarriage patients.
We believe that between 15 and 20% of our patients admitted to our wards have had a miscarriage of some kind.
Miscarriage is a very, very big problem because in a day we get about 10 to 15 cases.
There's a high level of miscarriages, and infection is one of the major causes of admission.
The common complication they normally get is of infection.
Infection later leading to secondary infertility and pelvic pain is the most common.
The infection will cause a lot of problems in their health in terms of chronic abdominal pain or infertility for many years.
Infection after miscarriage surgery is a very important problem and can lead women to become incredibly sick or even die.
Maternal death is a huge problem worldwide. 287,000 women die every year. This is around 1 woman every 90 seconds.
The AIMS trial is investigating whether giving antibiotics prior to the surgery reduces the risks of infection to those women.
It's a preventive intervention to see whether we can reduce the number of infections by giving these patients before they go to have a surgical procedure.
So we are going to test whether to use or not to use antibiotics in miscarriage surgery is effective.
This study is going to help us be able to come up with a policy to say this is the way we should be managing miscarriage in terms of reducing infection morbidity.
The AIMS trial is a clinical trial where we're comparing whether infection rates will be reduced if we give women antibiotics prior to miscarriage surgery, and we're comparing giving antibiotics, a single one-off dose, prior to the surgery with placebo, so a dummy tablet, so neither us nor the patient know whether they're receiving active treatment or the placebo.
The overuse of antibiotics is becoming a huge problem, and when we do need them in crises, actually they're just not working anymore. And miscarriage is such a common problem that to use antibiotics throughout the world in this situation leads to a huge, potentially overuse of antibiotics. Should we therefore, instead of giving it to everyone, just reserve it for those who do get an infection, and does it make a difference? So it's a crucial question, and largely because miscarriage is so common.
What's so important about the AIMS trial is that we're looking at women who may not have great access to health care, whose visits to hospital or to a health facility might not be that easy, and the opportunity perhaps of some kind of intervention prior to miscarriage surgery that could reduce morbidity afterwards could be hugely significant.
I think it will have a very big impact, first of all in my hospital, in Uganda, and in the whole world.